Providing catheter care for the female patient. Catheter care helps prevent urinary tract infections. If not performed correctly or frequently, it can cause pain, discomfort, and urinary tract infections. You will have 5 minutes to complete this skill. You will need a large basin, soap, 2 washcloths, a large towel, gloves, and a privacy blanket.
Good morning, Mrs. Johnson. I'm Nicole. I'm going to be your caregiver today. I'm just going to clean your catheter up. Is that okay with you? Okay, great. I'm going to go ahead and raise your bed up to waist level so I can protect my back. How's everything going for you this morning? I saw your grandkids. They're growing like weeds. Okay, so we always want to bring the bed up to your waist level. Protect your back whenever you're doing any kind of procedure with your patient. I'm going to walk to the other side of your bed and close your privacy curtain, okay? So you always want to give your patient privacy to protect their dignity. Okay. Okay, Mrs. Johnson, I'm just going to go ahead and wash my hands and get my supplies so we can get started. So I wash my hands. Again, we simulate for state. Grab our supplies. Come on back and we do a pre-prep. The peri-care and the catheter care has the same pre-prep, which means the sheet goes to the waist and then the blanket goes over top. We don't shake it. We don't put any linen or any supplies up against our body to avoid cross-contamination. You just want to place it gently. You don't want it to be up against you, so be careful about that. Okay. All right, Mrs. Johnson, I'm going to go ahead and take my supplies out. I'll go wash my hands and get water for you, and I'll be right back. So we go out, we walk to the sink, go ahead and turn the water on. We simulate washing hands for the purposes of state. You want to test the water, make sure it's not too hot, not too cold, no more than 105 degrees for the patient, so we don't burn them. We go ahead and fill the water, fill the bucket up. You don't have to put a whole lot, maybe about halfway. For testing purposes, we can go a little bit less than that. We want to make sure we have enough water to wash as well as rinse. Okay, once we have enough water, go ahead and pull the bucket out. You want to grab a paper towel. You want to turn the water off. The faucet is considered contaminated, so go ahead and just turn that off. Throw that away. And then we go ahead and walk back over to the bedside, and don't forget your soap. So I've tested the water. It feels great to me, but now we need Mrs. Johnson to say it's okay. Go ahead and expose her arm. And Mrs. Johnson, test the water for me. She says the water feels great. Okay. So now that Mrs. Johnson has said okay, now we can go ahead and put our gloves on. If your hands are wet, your gloves will stick. Okay, so for catheter care, we need to bring our table in front of us. Be very careful. Okay, so we go ahead and we bring the sheet down to the knees. Again, only exposing the body parts you're going to be using. We bring the gown up gently without pulling the catheter. Just go ahead and tuck that under the blanket. Okay, we do our towel, the same fold as peri, fold it in half. Fold it in half one more time. Put the flaps on the top. Now we just want to go ahead and gently pull the catheter back. We hold it at the connection piece. You pull it back. We want to make sure we have a little bit of a loop right there so we don't put any tension on the catheter. Go ahead and place that carefully just over the legs. Make a little indentation there, and we lay the catheter back down. Okay, so now we wash. Washcloth gets wet. Bring it out. Squeeze our soap on it. We don't want any soap in the water, so we lather away from the bucket. Then you want to grab at the meatus. Very important. You don't want to grab the catheter tubing. Place your hand firmly against the meatus so it protects the catheter. So we want to wash down 4 inches. And then we get a clean section. Still holding onto the catheter. You do not let it go and do not shake the washcloth. We wash down 4 inches again. We put that in the laundry. And then we rinse. At this point, you're doing everything with one hand. So you hold onto that catheter. Squeeze all the water out. Same process. We rinse 4 inches. We get a clean section without shaking. Rinse 4 inches. Put in dirty clothes. And now continuing to hold onto the catheter. Now we're going to dry 4 inches. So we wash twice. We rinse twice, and then we dry twice, always using a different flap. Twice. Continue to hold onto the washcloth. We roll it, to the catheter, I'm sorry. Then we take the towel, we roll it out, away from you and away from the patient, being careful not to pull the catheter out. The towel goes into the dirty laundry. And you can also bring the laundry container up as close to you as you need it to be. So now I can let it go. This hand is considered the dirty hand because it held the catheter. Put that behind your back. Clean hand pulls the gown down. The clean hand is the hand that was actually holding the washcloth. Let me bring the sheet up. So we get the sheet up and the blanket to the waist. And then again, we stop. We don't want to roll the blanket into the patient's face. So now we roll the blanket away from the patient. The dirty hand can touch the blanket because the blanket is going to the laundry. And then dirty hand goes back behind your back. Clean hand goes to bring the sheet up to cover the patient until you come back. Mrs. Johnson, I'm going to go dump my water. I'll be right back. Take your soap and your water with you. Okay. Soap back in the sink where it was. We go ahead and dump the water into the sink. Careful not to splash. And then we go ahead and we get a couple of paper towels. We're going to pat the bucket dry. Never want to put it away wet. Put it back into the designated area. Remove the gloves the right way from the palm. Put it off. Ball it up. Tilt your wrist back and you go under. You don't want to touch the top. Wrist back. Bring it over gently. Bring it off. Then again, we simulate. We wash hands. We go back over. Put the table back. We don't want your patient to fall over the table if they happen to get up. Hey, Mrs. Johnson, we're all finished here. You did great. I'm going to give you your call light in case you need me after I leave. I'm going to go ahead and put your bed back down to the lowest position for safety purposes. You always want to have your bed in the lowest position, so in case your patient falls, they'll fall from the lower position. Okay, now we're going to go ahead and walk around and we're going to open the privacy curtain. And then while you're here, go ahead and fix the sheets if it got messed up a little bit. Okay, we're going to fix the sheets. That's good. Okay, Mrs. Johnson, is there anything I can do for you before I go? Okay, that sounds good. Have a great day. We wash our hands and we document.